In this video, we'll discuss orphan diseases, what they are, and why their popularity in pharma marketing has increased recently. Some medical conditions are so rare that it's just not financially viable for pharma companies to research them. These conditions are often referred to as orphan diseases. So, an orphan disease is largely used as a synonym for rare disease. How have governments helped? Well, initiated in the United States, laws have been passed to facilitate the development of orphan drugs or treatments to treat these rare diseases. These laws would include things like tax incentives. As a result, there have been excellent advances in the last few decades, so that there are now treatments available for previously untreated and untreatable conditions. But there are problems. Let's have a look at cystic fibrosis. Cystic fibrosis is a serious genetic condition that involves repeated lung infection and possible intestinal blockages. And so the prognosis for cystic fibrosis is not good. Cystic fibrosis is more common in Caucasians, occurring at about 1 in every 3,200 live. Then, Vertex Pharmaceuticals developed a highly effective treatment called Trikafta. Brilliant. It's called Kaftrio in Europe and in the UK. Now, Trikafta is specifically designed for patients who have at least one F508 del mutation. And this mutation is the most common cystic fibrosis causing genetic defect. It's present in about 90% of cystic fibrosis patients. So Trikafta targets the underlying cause of the disease. Fantastic. But costs more than $300,000 a year. Now, on the one hand, we must applaud Vertex for developing such an effective solution. And they need an opportunity to be generously reimbursed for their enormous investment in developing this highly effective treatment. But on the other hand, very few patients who desperately need this treatment can afford it. The result is doctors get impatient with and distrustful of pharmaceutical companies. It seems to contradict the patient-centric approach that companies claim. And patients know that there is this miracle treatment out there, and they are antagonistic towards their doctors who won't prescribe it. Also, this high cost for the patient encourages illegal imports. If one's child had cystic fibrosis, one would be sorely tempted to find a way to get hold of the generic version called Trikafta, produced by Gaydor in Argentina. Trikafta costs about 10% of the original price. Now, this 10%, while significantly lower, still represents a substantial expense for patients. So, orphan drugs have provided hope for thousands of patients who suffer from rather rare diseases. And the last few decades have seen the development of drugs for rare oncology, neurology, and pediatric onset diseases. But some companies have taken advantage of the exclusivity and have charged exorbitant amounts for their drugs, making these orphan drugs unavailable for most patients. Do you have an opinion on orphan drug development? Please let me know. And if you need to improve your English fluency and you're in the pharma industry, please don't hesitate to get hold of me. I'm Janine from Janine Pharma English, and I can help.